This is going to be level 2 of our glute and hip preparation isometric series. So you're going to have a couple things that are going to be similar and kind of continuing rather from part 1, just at a little bit of a long duration most likely. So first thing we're going to be doing, again, we're going to be down on our back. We're going to have a mini band. If you need 2 just to get enough resistance, you certainly can. We're going to be here on our back. We're going to be in this kind of tabletop position here. And all we're going to do is we're going to have tension out on that band. So we're feeling that outer hip here working. And we're holding this position here, breathing in, breathing out. So we're literally just holding that position. That's all we're doing. And again, we're probably going to be doing this in level 2 at a little bit of a longer duration. Okay, so that's the first one. The second one is going to be very much more from a groin preparation standpoint. So what you're going to do, you're going to take a medicine ball like so. Medicine ball is going to go between the knees. So you're going to be lying flat on your back. You get medicine ball between the knees here. And all you want to focus on, so you want to think about tucking that pelvis underneath you. So as you can see, I'm not arched up like this. I have that pelvis tucked underneath. I'm engaged from my core, and all I'm doing is I'm squeezing in on that ball, keeping that tension here from a core standpoint, and I should feel that kind of inner groin working, and I'm holding that for a certain duration. Again, nice and easy. You're not trying to go max effort. You're trying to hold it for the designated amount of time. That's going to be the second one. The next one is going to be now a bridge, but with a ball in between the knees. So now we're getting a little adductor, a little bit of glute. So we're going to be here. Again, I like a med ball. It gives you a good amount of width. If all you have is a soccer ball, it's smaller. That's fine, but this works good as well. So you're going to be here. You're going to be tucked underneath. You're going to go into that adduction nice and easy, about 20-30% effort. Core is engaged, pelvis tucked underneath. You're bridging up, and you are just holding this position. You want to think about everything in a nice, straight line. Knee to hip, all the way up through trunk. Everything's in a good position. I'm not flared out like this. Tucked underneath. I have some good groin activation and some glute activation as well. So again, that's going to be the third thing that we are going to do from that standpoint. Now, the next thing we're going to do is going to be a banded fire hydrant. So in level 1, we did a fire hydrant without any resistance. Now we're going to do it with a little bit of resistance. So same thing. We're going to be here. You're going to bring that hip out to the side at about a 45 degree, and we are just holding that now. So again, this more than anything is getting the back of that glute. We're not over-rotating like this. Hips stay down. We're coming out to the side, and that's it. One of the last things we're going to do here is going to be more of a progression of, the split squat. So let me back up. We're going to do a split squat. So we're going to be in that position, hold here. Again, I don't want to be very aggressively forward here. We're going to be back a little bit like so. And I want you to think about you're pulling yourself down to the ground like this. So as you can see, I'm on my back toe here. I'm in a good angle here. My ribs are tucked down, core's engaged, and I'm predominantly knee is over my ankle in this 90-degree position here. And I am just holding that like so. Again, I'm almost thinking about pulling myself with my foot and my hamstring down to the ground. You should very much feel that back glute working. And the last thing we're going to do is almost like a kind of pseudo skater lunge hold. So you're going to be in a more of a loaded position here. You're going to have this knee forward and you're back into the hip, and you are just holding this here. This other leg is back behind you. As you can see, there's a little more of a balanced component here, and we're just holding this. We're getting a very strong glute back of the hip stimulus, holding that, and then we're coming up. So that's more of our level 2 progression that we're going to go through.